Well, hello everyone, welcome back to my channel, wherever you are, grand day rising, welcome to all. And now we are in the merry month of May, so let's see what goodies May has in store for us, shall we? And keep positive and keep vibrations high. Today I would like to talk about an update I have received from my MP for East Thanet, Polly Billington, about fixing our NHS. Case reference PB, which is Polly Billington 3866. And this is in response to my email to her in recent months about showing my concerns about the NHS. I must say now that I am a member of various pressure groups such as Age UK, Change.org, Organise, Just Treatment, etc. And I probably wrote through one of those. Sometimes I do multiple actions. I will email through one or more of those pressure groups. Dear Catherine, as someone who has written to me before to share your concerns about the NHS, oh, she's calling me Catherine now, I wanted to write to you to update you on everything I and the government have been doing to fix the crisis in our health service in recent months. Tackling the challenges facing the NHS is one of my highest priorities as an MP, because it is not acceptable that after 14 years of cuts and mismanagement, so many in our community have been left struggling to get a GP appointment, waiting hours for an ambulance, or stuck on an NHS waiting list. That chaos is costing lives and leaving people in pain, and I am resolutely committed to bringing a stop to it. Well, that's good indeed. And yes, I mean, we had 14 years of a Tory government and they basically spaffed every opportunity. But this has been going on for longer than that. It's a number of decades where healthcare in the UK is being undermined, partly as well, may I say, by woke projects, which we all know about, in line with certain agendas, which may include the numbers 2030. And of course, some of the problems have increased significantly since the global incident, and a lot of us cannot help but rally round the story that it's to do with certain gearing and global strategies. She says, we need better services in Thanet. That's why I'm backing the creation of a new NHS health hub in Broadstairs, which will include GP surgery and same-day access to primary care, community services, district nursing and children's services, an MRI scanner and voluntary sector services from Age UK, all under one roof. Well, the NHS Health Hub is indeed a positive step forward in addressing the health of those in Thanet. There are a lot of challenges in this area, and encouraging healthy diet is probably one of them, and regular exercise. But there's a lot of people who have retired and moved down to the coast, and let's be honest, a lot of them may have moved to the coast to improve their health and well-being as well. So they've got various challenges, arthritis for example, or they just might be wheelchair bound. There's people who are desperately in need of accessing mental health services, which was bad in this area before the global incident, but our GP told Dan when he went 2-3 years ago that the situation has only got worse. Last October, the Chancellor announced a huge funding increase for the NHS, the largest since Labour were last in government outside of the pandemic. That funding of 22 billion extra for frontline services and another 3 billion for new equipment and buildings is a huge down payment on getting our health service back on its feet after years of underinvestment and underfunding. Wait a minute, 22 billion, isn't that the black hole? And the extra 3 billion, wouldn't that have paid for the winter fuel allowance perhaps? I don't know how these figures are bandied about, but bearing in mind the level of public spending and donations to overseas since Labour got in 10 months ago, the numbers quite astound me and don't really add up, if truth be told. But I'm sure Rachel from accounts will be able to fill us in due course about how this money has been raised. Perhaps the taxpayer, again, as usual, is the one footing the bill. Of course, the taxpayers all have magic money trees somehow, although I'm yet to find one. I'm just putting that out there. I'm also delighted that the government is investing 900 million in ending the 8 AM scramble for GP appointments and ensuring that anyone who wants a face-to-face appointment can get one, and is also committed to delivering 700,000 additional emergency dentist appointments. We have also frozen prescription charges, keeping them below £10 each and saving patients 18 million next year. Well, healthcare in the UK and within Thanet, I know from when I've had a look on various Facebook groups, people moaning about their GP practice, it's very much a lottery. There seems to be no uniformity at all within health services in the UK. A lot of it depends which area you're living in and the NHS trust, whether they actually have any money or whether they're in a desperate situation like the East Kent Healthcare Trust. And also the personnel working within those trusts. Anyone who has used the NHS recently knows that money alone can't solve the problems that have built up in recent years. Well, it's more than recent years. Both myself and my mother are former NHS employees, and it's been chaotic for a very long time. I used to work as a temp, and the offices I went to were quite frequently in a chaotic state. There were a lot of layers to management and tick boxes and various other so-called strategies that sometimes got in the way of healthcare itself. Anyone who has used the NHS recently knows that money alone can't solve the problems that have built up in recent years. That's why the government launched a national consultation on the future of the NHS last year to gather the public's views on how they think the NHS needs to change. I would say drop some of the bureaucracy and some of this push for digitisation of everything. I would also like to say that the other year Palantir, which is owned by Peter Thiel, a data gathering company, has been awarded yet another NHS contract, and I want to know what's going to happen to my healthcare data, which is why I avoid at all costs going online to do anything health related. I don't want anybody knowing my personal data or having access to it. Thanks very much. Since then, the government has embarked on a huge reform programme to cut waste and bureaucracy in the NHS. I've yet to see it. Over the next 2 years, the NHS will be brought back under the control of the Department of Health, enabling us to reduce the number of unnecessary management roles and saving the taxpayer an estimated £900 million per year, which will be ploughed back into frontline services instead. Well, let's hope so, and hope that it doesn't go again to any humanitarian efforts overseas. In recent months, we have seen some welcome signs that our plan to turn around the NHS is working. Waiting lists have now been falling for 6 months in a row. 3 million additional appointments have been delivered, and our target of recruiting 1,500 GPs has been met early. But our practice is still desperately short of GPs. But I know there is so much more to do, which is why I will continue pushing hard to support the government to go even further and faster when it comes to turning our NHS around. I believe strongly in the NHS, and I will never give in to those who want to force people to pay to use it. So please rest assured I will always stand up for an NHS that is there for all of us when we need it, free at the point of use. Best wishes, Polly Billington MP. So I wrote to her, "Dear Polly Billington, thank you so much for your email. The NHS has indeed been allowed to fall into a deplorable situation, which consequently has manifested in many dismal and critical ways." Note, I haven't said recently, I've just said has been allowed to fall into a deplorable situation. I said it like that on purpose because, as I've said, it's not just the last 14 years, it goes back a lot longer than this. When the NHS was founded in 1948, I don't think anyone could have imagined the sorry state it would find itself in 75 plus years later, especially when it had been a healthcare system that set us apart from other nations as one that had been open to people from all backgrounds and social classes, not just the privileged minority who are in a position to pay for their health and well-being. I too welcome the prospect of the new NHS hub in Broadstairs and hope that there will be the public transport infrastructure in place for people to access all those services the hub will offer, as there are glitches in that system at present in our local area, as many local people do not have their own transport and may not necessarily be able to afford a taxi, and of course there are many elderly and those with mobility and other issues, including hidden disabilities, who may be unable to travel a considerable distance to the nearest bus stop currently available, since Stagecoach reduced certain bus services a couple of years ago now. Whilst I mostly choose natural healthcare solutions over allopathic medicine, I have seen many comments in local groups on Facebook that it is often nigh impossible for people to access a face-to-face appointment, and how much access to GP services have worsened since the global incident. What we definitely need is less bureaucracy and more qualified frontline staff, and I welcome the end of NHS England, a quango that has wasted precious public money on various vanity projects, propaganda and wokery, and put public health and well-being at substantial risk. At its worst, a 7+ million NHS waiting list is not what one would have ever expected when the NHS was established all those years ago, and I am pleased to hear that waiting lists have shortened considerably, notwithstanding, as you quite rightly say, there's still a lot more work to do. I would also like to draw your attention to the fact that some GP practices in Thanet, including mine, have instigated the Anima digital system, whereby patients must use the online form and are then triaged by a member of the practice team in order to seek a doctor's appointment. Whilst I understand the rhetoric and the reason behind adopting the Anima system is to improve efficiency and to ensure that patients are treated more expediently, not everybody has access to a computer, a smartphone or even a basic mobile phone, nor does everybody have the capacity to do so for whatever reason, and they may not even have a person they can call on to advocate on their behalf. Furthermore, digital systems are increasingly vulnerable to hacking and other breaches, and more open to theft of health data and ID fraud. I think insisting that patients access healthcare via digital systems is morally and ethically wrong and reinforces divisions in society. Having been a victim of online data fraud on more than one occasion, I personally will refuse to use any online system to access healthcare from my GP practice and would rather pay to go elsewhere if needs be. With best regards, Catherine Evans. So there we go. But what do you think? Let me have your comments. Do you think that is a good reply about the NHS? Or do you think that the NHS is a diseased, toxic bird which has been infested by a variety of global elitist agendas and for which there is no cure? What's your thought about health hubs? Do you think they're a good idea? And what about digital systems to access healthcare? Even if you don't agree with me, not a problem. I'd just be interested to hear your thoughts. If you enjoyed this video, please give it a like. Do please comment, share, subscribe if you haven't already done so, ding the notification bell, and thanks so much for watching, and I'll see you again soon for the next one. Until then, bye for now.